Hospital chaplains normally counsel patients and their families, but they're finding that they are needed more than ever to help support doctors, nurses dealing with crisis every day.
Reverend Cassie McCarty is with Dignity Health Glendale Memorial to explain how their work has been impacted by the pandemic. Good morning. Thanks for joining us. You normally counsel people in the hospital who are there as patients or their family members. Are you being contacted more now by healthcare workers, and what's that been like?
Good morning. Thank you for having me. I wanted to start by mentioning that chaplains are professionally trained healthcare providers that spiritually support patients, families, and staff. So chaplains have always been a part of the healthcare team by providing support for staff, and we continue to do so now more than ever. It's important for our staff. Currently, our staff are really appreciating chaplain visits. We round on the night shift, day shift. And what I find mostly is that they are like any one of us. They're asking questions. How long will this last? Will their families be okay? They're asking those very, very human questions that you and I are thinking and wondering about right now. And they're also very inspiring for me right now. I asked one of our nurses one time, "How are you doing right now?" And she said, "Cassie, I am fine. This is what we do as nurses, and we keep doing it until we can no longer do it." So I find them to be very inspirational right now, too.
Resilient, yeah.
Are you doing it in person? Are you doing it remotely? Are you incorporating the both? How's your work happen?
For patient visits, that is pretty much virtually right now by phone or by iPad. But for staff, the chaplains are still here. We have had longstanding relationships with our staff. We are still here for them. We're on the units with them. So we're with the nurses, the phlebotomists, the housekeepers. We are with everyone. And I think that brings a lot of comfort to them, knowing that we are still with them in this, literally with them in it. And I will go upstairs, see the staff. I might have 5 seconds with them. I might have 5 minutes with the team. I offer prayer sometimes, a listening ear. Sometimes we crack jokes with each other. I remember one time a staff person missed lunch and he didn't have any lunch. So I went down to my office and got one of those noodle soups that you just add hot water. So just trying to provide practical needs, meet practical needs for them, meet their needs for inspiration, just be present with them and listen to their stories.
Wow, well, you're doing wonderful work. Thank you so much, Reverend Cassie McCarty with Dignity Health Glendale. Thanks again for joining us.
Thank you so much.
And as we continue